All right, good to see you all. See some familiar faces from the last training that was focused on emergency shelter, but definitely some new folks as well. So we're going to do some introductions as we get started today. But you are here because you are joining this Keys to Effective Low Barrier Emergency Shelter training. It's a mouthful. And today we're really going to be focusing on what low barrier shelter is and the policies, the environment, and services that go into making low barrier shelter possible. So as far as goals for today, really focusing on basic principles and conditions for making low barrier shelter possible, exploring practices for decreasing barriers to emergency shelter, and really looking at what other low barrier shelters have done as far as policies, environment, and services. And then taking some time and using some opportunity. Oh, did someone come off mute? Okay. Using the opportunity of being in the space together to have some discussion to really examine emergency shelter in your community, or if you work at a specific emergency shelter, and really thinking about what are some adjustments that you can make to your shelter to be more low barrier. So Ellen and I will introduce ourselves. We're going to ask you to also introduce yourselves in the chat. If you could share your name, the organization you're with, and then it would also be helpful if you could tell us if you're a case manager, if you're like shelter operations staff, if you're a program manager, executive director, whoever you are, it would be helpful to understand who we have here today. So while we're going through this agenda and introducing ourselves, if you could take a moment to do that, that would be really helpful. That will also help us understand who is here today, because you do have the option of receiving a certificate of completion for the training. So please go ahead and introduce yourselves in the chat. So like I said, we'll focus on the what and why of low barrier shelter, really dig into practices. And then we're also going to spend some time talking about how do you make the shift if you're not a low barrier shelter now, but want to become one, or maybe you're kind of close to being a low barrier shelter, but there's some specific barriers that you want to reduce or eliminate. How do you go about making that shift in your own shelters or your own homeless response systems? So like I said, I think many of you were at the training that Ellen and I did previously on the role of emergency shelter in the homeless response system. But if we haven't met you yet, I'm Jenna Espinosa. And Ellen, if you want to say hi or just wave. Nice.
Good morning, everyone.
So you'll be seeing our faces mostly. And we both work at Technical Assistance Collaborative, or TAC. So we're an organization that supports communities, local governments. We contract with federal government, nonprofits to address areas of housing, homelessness, human services. And we're Boston-based, but we have folks all over the country. I live in Portland, Maine. Ellen lives right outside of Boston. And yeah, we both worked in homeless services previously before coming to TAC. Both of us worked in Boston organizations, and then I've also worked in a few other communities in Texas and Colorado. So happy to share some of our own experience, but really we're just here to share what we've learned from other communities and share best practices, and also just facilitate an opportunity for you all to think together about how to reduce barriers to shelter in your own community. So I see a lot of folks putting in the chat. That's very helpful. Thank you. Okay. Any questions before we jump into content today? Any technical issues we can troubleshoot? Oh, I guess I should mention, we do have the Q&A function for folks. So if you have a specific question, it might be helpful to put that in the Q&A. If you're having like a technical need, or just making a comment, feel free to use the chat for that as well. We have about 24 people here today, so you're welcome to come off mute if you have a question. There's also a raise hand function, but we have a fairly small group, so don't hesitate to come off mute or put something in the chat if you just have a comment. And again, if you have a question, feel free to put it in the Q&A. And we also love the react buttons. Those are always fun to see. Okay, so low barrier shelter, what is it and why would you do it? I think low barrier shelter is a very popular discussion folks are having right now. So you've probably heard the term, and it really is what it sounds like. It's the shelter that is immediately accessible because the shelter has reduced or completely removed barriers to entry in some ways and for continued stay as well. So historically, we've seen shelters and currently many shelters use policies and practices that have either intentionally or unintentionally prevented households experiencing homelessness from having safe, dignifying, and temporary place to stay. And the reason I say intentionally and unintentionally is because most of the time in our work, we see shelters who unintentionally created barriers because they have policies or environmental characteristics or services that are really because of their funder, it's because of reacting to maybe a situation or event that had happened in shelter. So it really was designed to mitigate specific instances or concerns, but what that's led to is additional barriers to people entering or being able to stay in shelter. And we're going to talk about what impact that has had. But I also say intentionally because we are hearing more voices uh, really moving away from that housing first lens and that idea that shelter is like this innate human right. And there are shelters who and supporters of these types of shelters who have intentionally created barriers to shelter. So they're creating these high barrier shelters um, because of I guess at times wanting to control behaviors of people, to be frank. And so we do see that, and we are seeing voices support that more and more. So it's incredibly important to also have the conversation about low barrier shelter and its importance in supporting people experiencing homelessness. And low barrier shelter really does support the idea that everyone has innate dignity and respect and deserves respect, and that shelter is a stepping stone into housing as well. Any thoughts or questions about that? Okay. So when we've seen these historical policies and practices that have created barriers to shelter, what we've seen is that there are people who have really traumatic experiences staying in high barrier shelters, um, spending longer times in those shelters. We also see an increased unsheltered homelessness. That is a very common impact that we see in a community that does not have any low barrier shelter or very little low barrier shelter. And what we hear about from those communities is that people are choosing not to come inside for reasons related to shelter entry. So it could be the process of getting into shelter is too burdensome. It could be that they're not able to maintain their job in order to have a place to sleep at night inside. It could be the shelter practices don't allow them to maintain certain relationships, like with their pet or significant other, for many reasons. And we've seen that lead to this increased unsheltered homelessness. And I think you all have seen an increase in Rhode Island specifically as well, a great deal of increase happening. When that happens, there's also this increased concern from the community at large about public health, safety, and those conversations can get really difficult to have. And also inefficient use of resources as well. We've seen that when people have a safe, consistent place to stay, it is easier for them to move on to housing. And we see a lot of systems get stuck in different areas, and people experiencing homelessness get stuck in different pieces of the system because there isn't that movement through the system because of that.
So I think, as we start talking about low barrier shelter, it's important to understand some of the impacts as you're considering why you might do it, right? Because in many cases, folks might think, well, what's the purpose? Just to let people, be able to do whatever they want. And that's not necessarily the case. We see some really tangible impacts when folks start to implement some of these practices that benefit not only the guests who are staying in low barrier shelters, but also the shelter providers, the system at large. And so we really want to kind of lead with why this can be beneficial, right? So Jenna shared some of these examples just now, but in a more traditional shelter setting, we might see that folks have a difficult time finding jobs or keeping jobs or staying connected to their service providers or following through with housing appointments and pursuing housing opportunities. And that might be, in some cases, related to shelter policies, right? So, for example, if the emergency shelter has really strict requirements related to folks leaving at a certain time in the morning and maybe a really strict curfew in the evening that doesn't align with somebody's employment, they're not going to be able to keep that job, right? Or maybe that's going to lead to them choosing to stay unsheltered, and then that leads to them not being able to maintain the job. And we could pull out similar examples related to service connectivity and housing search, right? But again, just seeing kind of what the impact might look like if we reduce those barriers, folks may be able to find and maintain that employment a little bit more easily because they have either some flexibility to ask for exceptions to those requirements around curfew, or maybe that barrier is eliminated entirely. I think that's another important distinction to make, right? Low or no barrier. When we say low barrier, we don't mean throw all the rules out the window, but we do mean that we're trying to make things more accessible for people wherever we can, really reduce those barriers whenever it's possible. Jenna also mentioned being able to maintain supportive relationships. So in a more traditional shelter setting, when we hear that word, we're probably thinking of, group sleeping spaces, maybe big rooms with multiple bunk beds. That is not necessarily conducive to people being able to stay with their spouses or significant others, with children, especially older children, right? So this sort of traditional model sometimes means that people are separated from the folks or the pets that they are close to that help, really help them to maintain emotional stability and navigate, the difficult time that they're experiencing. In a more traditional shelter model, we're often asking the individuals who are experiencing homelessness to overcome barriers, like, for example, Ellen, you have to be sober in order to get a bed tonight. Versus in a low barrier shelter model, we might do some of that barrier reducing for folks, like having specific beds that are available for people who are not able to maintain sobriety, or beds that people can come into if they're not sober in that particular moment, right? So we're not asking the person to overcome the hurdle of, getting clean in order to have a safe place to sleep. We are reducing that barrier for them and creating this space. Often in traditional shelter settings, folks can't hang on to some of their most important belongings, whether that's because there aren't spaces for people to keep things. Maybe there are requirements around which types of belongings you can and cannot bring in, whether that's related to size or number of things, right? Any number of policies like that lead to people losing things that might be really important to them. Or, as Jenna mentioned, lead to people making the choice not to come inside at all. In more traditional shelter settings, we're often seeing people having to compete each night for a bed, whether that's like lining up to get in line for those beds each night, or sometimes a lottery system for a bed. Whereas in a low barrier model, we might see that folks have a more predictable place to sleep each night because we're not asking them to line up. Maybe they sign up for a bed for a week, or any number of ways that could be structured to give a little bit more stability, help reduce some of that stress. And then finally, in more traditional shelter settings, participants often report that they feel like the experience is demeaning or discouraging, that it can be hard to take those steps to move on in that kind of setting, right? I think, again, the intentional versus unintentional, a lot of times shelters feel really institutional and sometimes kind of jail-like, and I don't think that's the intent of folks who run them or work there, but it's kind of just what ends up happening over time in more traditional shelter settings. Whereas when you really start to be more intentional about the environment, folks might find that they have a more dignifying or empowering experience. So really just to show you some of the impact that we see when organizations and emergency shelters make this shift from, sort of status quo to really thinking about how to reduce barriers for people. And in order to do this, there are some principles that need to be in place and sort of agreed upon in your community at large, or at least within an organization, in order to allow for the low barrier shelter model to work. So some of these principles include a belief that everyone should have access to shelter who wants and needs it, that shelter acknowledges the dignity and worth of all individuals, and that it supports faster access to permanent housing. So, we need buy-in around this concept from the top to the bottom if you're going to make a shift to reduce barriers to emergency shelter. Also, the belief that it's the system's responsibility to make shelter accessible and not the responsibility of individual people experiencing homelessness to overcome barriers. So just another thing that you really need buy-in around in order to implement low barrier practices. The belief that shelter staff from operations all the way up to management believe in the principles around low barrier shelter access and are supportive of carrying them out. That low barrier shelter model is supportive of the community's goals in addressing homelessness. So that, the practices that emergency shelters are putting in place are supportive of the system-wide goals. So some of what we talked about if you joined us in the previous emergency shelter training, right? Whether that's related to reducing unsheltered homelessness, finding ways to bring more people inside because we're reducing barriers. Belief in the efficient use of resources across the system. So investing resources wisely, including housing and shelter resources. And then lastly, that, the work is driven by an evidence-based housing first, harm reduction, and trauma-informed approaches. So we really see that communities succeed with making the shift to low barrier shelter. Maybe not in every shelter in the system, right? There's a place for everything, but creating some pool of low barrier shelter beds, at least when these principles are being upheld and are, believed in again by the folks who are doing the work in that community. So I think we're gonna pause here and get everybody a little engaged in some conversation before we move on to talking about actual practices and how you can think about implementing low barrier shelter. We are gonna move into breakout rooms for a couple of minutes to have some conversation about what things look like in Rhode Island right now. So if you're thinking about those principles that are really essential, that have to be in place in order to operate low barrier shelter in a community or an organization, doing a little bit of a self-assessment to gauge, like, what does this look like in Rhode Island right now? Do we currently uphold this principle? If so, is that outlined in writing anywhere? Do we talk about it openly? Is it evident in the way that we're operating? Is it just some organizations that are operating this way, or are we demonstrating it system-wide? Have we had training, or is there anything related to accountability around this principle in our community? So really just kind of gauging where you're at when it comes to these things. And if folks, as you're having the conversation, want to kind of gauge on a scale of 1 to 5, so 1 being, oh, I don't think we're quite there yet, or we're not quite, doing that or embodying that principle yet, all the way through to 5, where yes, most definitely we are doing it. It is evident in our written material. It is evident in our work. It's most definitely a principle that we are embodying. And I think we're probably going to ask when we come back together, maybe for just a few folks to share a little bit about what, the conversation looked like in your groups. And because it's probably hard to remember what those principles were, we are also going to give you a Google document in the chat that has them listed so that you can refer to that in your conversation with folks. So Rosa is going to move us into breakout rooms. Jenna, how long do you think we should give folks to chat?
I'd say let's do 10 minutes. I think that's a good amount of time.
Okay. So I'm going to put the link to the Google document in the chat for reference. We'll give folks about 10 minutes to talk, and then we'll come back together.
Okay. How do we feel about getting started again? Doesn't seem like there are any other questions. Okay, Melody's ready. Good to hear. Okay, let's go for it. Thank you for letting us take some time to help people get connected, because we do want this to be interactive. And we're hoping that you all can walk away with some next steps from this action planning and this reflection. So really appreciate it.
Okay. So I'm wondering if anyone would be willing to share a little bit about your conversation, if you were able to talk with folks in your breakout room. You don't have to share if you got through all the principles. I doubt that, but if you talked about one or two, if there's anything that you found interesting in your reflection, anything that you want to highlight as you thought about where your organization or where the Rhode Island Continuum of Care in general was at with these different principles. Folks could pop things in the chat. If you want to come off mute to share a little bit about what you talked about, you're welcome to. Hearing from one or two folks would be nice. Go ahead, Melody.
Our group talked about the implementation of these ideals at our respective places, and we talked about how the language of trauma-informed care and housing first and harm reduction is definitely being talked about, which is great, and it's definitely included in the planning and training. But we also talked about the room to grow when it comes to implementation. It's kind of hard to eradicate the us versus them mentality and the stigma surrounding the clients we serve. And there are often issues with understaffing and overworking and burnout, as well as a lack of resources to provide certain services to clients, like just a lack of space to help clients keep their belongings, for example. So yeah, those are some of the things we talked about.
Thank you for sharing that. That is super real, right? A lot of times we want to be able to do these things or uphold these principles and maybe don't have the resources to do that well or to do it at all. And so that's an important consideration. But also, I should acknowledge, really great to hear that it sounds like some of these principles are being upheld in the organizations that you work for, in practice and in your policies. How about others? I know some folks had some difficulty connecting, but we had several groups, so I'm sure there was at least one more where folks had some conversation. No? Okay. Well, we'll keep it moving. And I think that hopefully we'll have better luck with the next discussion.
Okay, so we're going to move into talking more specifically about practices, tangible practices that other shelters and probably many of the shelters that you work at have implemented already to reduce barriers. And we're going to use this framework of policies, environment, and services. So policies meaning which policies either create barriers or reduce barriers to entry, and then also thinking about barriers to housing as well can be helpful in a low barrier shelter. Environment meaning the physical characteristics, the kind of culture of the organization, how people feel when they're in the shelter, those types of environmental characteristics that keep people from coming inside or really support people and feeling safe to be there. And then services, what we mean by services is the mix of services that are available and offered in your shelter. So that could be the types of services that make this low barrier model even possible because it supports the safety and health of folks staying there. It could be services to help people move on to permanent housing as well. So we're going to get into those specific practices under each of these buckets. And you'll see that some of them kind of fit into all these buckets or maybe two of these buckets, but it's just a framework that has been helpful for people when they're thinking about shifting certain pieces of their certain aspects of their shelter. So before we get into that, would love to hear from you because this looks different in every community. What are the reasons households experiencing homelessness don't come into shelter in your community? So we mentioned some examples earlier. Sometimes it can be related to pets or being in a couple, but if you have spaces for those people in the system, maybe it is more about active substance use or whatever it may be. So like we said, it looks different in every community. So really curious to hear from you all. Like when you are working with someone who has come into shelter for the first time after being in an unsheltered situation, if you all do any intake work into the shelter, what does that look like? What are reasons why someone wouldn't be able to come inside or maybe choose not to come inside? And you can just come off mute. Rebecca, I see you're raising your hand. Feel free to put it in the chat. Rebecca, you want to go first?
Sure. I usually, from what I hear from clients, is that they don't like the rules that they have to follow. Like if there's a curfew, that's definitely something that I hear often.
Mm-hmm. Yep, curfew. Yep, Larry, I think your hand was up.
Yeah, I know that some people in recovery struggle in some shelters to stay sober, so that becomes like a really big barrier for them to stay for long periods of time.
Mm-hmm. Yep. Yeah, Jaleel.
Hi, it could also be that some people just like communal spaces, maybe like how they're in the same dorm with somebody and so forth.
Yep, that's a really good point. Having trouble being in proximity to others for many reasons. So yeah, Dion, I see your hand up.
Oh, yes, that was the same answer that I had.
Okay.
That some of them don't want to be around people who they're not familiar with. They're afraid, or pets, or reasons like that too. You know, they have.
Yep,
Yeah,
definitely.
thank you.
Thanks. Yeah, what else? Yeah, Gary, I see your hand up.
Good morning. The amount of personal belongings they could bring in.
Mm-hmm. Personal belongings, that's a big one that we hear a lot about. Yep.
Because here at the hall, we have bunk beds. So, you know, you pretty much you have one drawer and whatever you can fit on the mattress you're sleeping with.
Mm-hmm. Yep. Yeah, the other side of that I hear a lot is people being really afraid of their things being stolen. I know at the shelter I work at, this is probably what happens at other shelters, but people used to put their shoes under the leg of the bed to like make sure their shoes wouldn't get stolen at night. So even things like that, that feels like not as big of a barrier, but when you have all those things adding up on the day-to-day, that can really deter people as well. Larry, I see your hand.
Handicap accessibility too.
Handicap, yep, definitely. Yeah. Are there any barriers that we've said so far that your system has found ways to overcome? I think someone mentioned earlier, or maybe this was in a previous training, that your shelter does have shelter space specifically for couples. Is that the case? Are there other kind of specialized spaces for people that have actually reduced barriers already?
Well, Hartford is a couple shelter,
Oh, nice.
and we also allow pets. So
Fantastic.
there's two. Yeah. So there's
Great to
two
hear.
there.
Awesome.
And we have the private room, so it can help people, who have jobs and stuff to, be able to get some, sleep. It can help them stay sober as well to get away from like the rest of the communal living spaces. So those private rooms
Awesome.
do help out a lot with a bunch of different barriers.
Yeah, that's great to hear. Melody, I see your hand.
Yeah, at Crossroads at the 160 Broad Street location, we have 2 medical respite bays where clients can be discharged to from the hospital who have a lot of medical needs and have to get to appointments on a regular basis and would really struggle to do so without that specific space set aside.
Yeah, that's so important. Thanks. I think I saw a few other hands up. Feel free to just come off mute. I'm not sure I'm catching everyone's hands, so.
I also work at the couple shelter with Larry and Rebecca. We also acknowledge that, sometimes couples need space, so we also implemented a rule like maybe like one couple could stay in their dorm area and so forth, and the other couple can stay in the TV room just to diffuse or like get a break from their partner side where they're not getting into like a bad argument and then having to leave the shelter.
Oh, nice. So using existing physical spaces as needed, having flexibility to support when situations come up. I love that. Anyone else? Okay. Yeah, really interesting. It sounds like your community has found ways to overcome some of those common barriers we've seen. And then it sounds like there's also room for improvement on reducing barriers for other folks. So some of these practices will probably be familiar to you all. So starting with policies, remember our framework of policies, environment, and services. So we're going to start with policies here. And what you see on this slide is actually really focused on intake policies specifically, but we'll get into other policies as well. Reducing intrusive questioning has come up a lot over the last few years, especially when we're thinking about coordinated entry, the types of assessments that communities have used through coordinated entry. This is the same of shelter intakes. And we see very different types of intakes for shelter. Some of them are very inquisitive and ask a lot of questions. Others, it's like really low barrier. And so the idea of reducing intrusive questioning is really making sure that we're really only asking what is essential to know for their initial stay. And really thinking about like what can be asked on night 1 versus is there more information that you might gather for the purposes of service connections or other reasons after their initial coming into the shelter. I think you all can probably imagine why, and we talked a lot about this in our previous training on the role of emergency shelter, but just that stress overload that happens with people who are actively in crisis. And then also just the feelings of judgment and shame that can come along with deep questioning, even when the intention is good. So screening in instead of screening out is a concept that a lot of low barrier shelters have adopted. And it's this idea that we're not gathering information in order to keep people out. We're really only gathering information to keep people in. And that means we're not gathering information because it's just not necessary sometimes. And we know not all of this might be the case for you because you might have funders or you might be in a specific location that does require certain screening to happen. But the goal would be to have no criminal background checks or income evaluation, drug or alcohol testing, any type of like conditional circumstances for someone to be able to stay. We've seen some communities also prioritize shelter beds, or if there's limited shelter space for specific subpopulations, that they prioritize most acute and highest need. And they actually work as a system to then triage people based on their needs. So it sounds like your system actually has different spaces that are specialized and located in probably different geographies or different shelters. And so then the question becomes like, how do you all work as a system to make sure that people who need those specialized spaces have access to them? And that can be really challenging, and we'll talk more about that. One practice that people have moved on to is not requiring lining up for a bed at a specific time each night. And that if a bed is lost, if someone doesn't show for one night, they lose that bed. And I've worked at a shelter like that before, and it can be really tricky as a staff person there to manage that as well. It's like managing this constant frustration for people, but it's also folks not having this predictable place to stay at night, and that can take up a lot of that executive functioning that is already limited. And then one concept that low barrier shelters and organizations that advocate for low barrier shelter has said is like an absolute need in a community is shelter access being 24/7 and or having flexible curfews. I think many of you from experience, and I know for me, crisis often happens at night. It really does not happen as much during the day. It just kind of works out that way. And so having that access be 24/7 can be incredibly helpful. And then the flexible curfews can be helpful in that reason, but also for the reasons that Ellen was mentioning when we talked through the impacts. So thinking about how a flexible curfew can support someone in staying connected to their natural support systems with their children, with their significant other, being able to maintain employment. So this is a good example of like a policy that was put in place with good intentions that often acts as a big barrier to people being able to stay at a shelter or to maintain the supportive aspects of their life outside of shelter that ultimately help them move on to permanent housing as well. Any questions about these?
Jenna, can I share an example, just an additional thought?
Yeah.
Reading that bullet related to curfews, I'm reminded of an organization I was working with once, it was a youth shelter, and they were really proud of the fact that they had flexible curfews for young people, which is amazing. But what they didn't realize was that in creating the policy around flexible curfews, they had actually imposed a barrier unintentionally, where in order to have that flexible curfew, folks had to show a pay stub to prove that they had a job. And I was talking with this one young woman who was working under the table. And so her employment was at night, and she wasn't able to get that curfew flexibility from the shelter because she didn't have a pay stub because her work was under the table. And it was just kind of this administrative mess that they had done the right thing. They had tried to figure out a way to reduce the barrier, but in doing so had accidentally created another little one. So I just share that to say, constantly be thinking and interrogating as you're, looking at policies and thinking about the ways that you want to reduce barriers, because little things like that come up all the time.
Yeah, that's such a good point. And we'll talk more about this later, but it does make me think about who needs to be involved in examining those policies and creating policies. Because when we involve people with lived experience who have had the experience of staying in shelter, or maybe they're currently, those are things that they can foresee. Then there are other things where people who have worked in a homeless response system for a long time. And so when we have both of those perspectives together, those are the type of issues that can be resolved, and then having that ongoing feedback process. And it sounds like that community did and was able to resolve that policy. So that's cool. Any other questions? Okay. So some more policies that we've seen in low barrier shelters. This is very important and very common. Not requiring participation in services or treatment. One requirement that we don't talk about as much, though, is this requirement to like contribute labor or chores in order to stay there. And so that's another one, that's a great option, I think. And we've seen shelters have programs where it's like this job training situation where people can work for the shelter and gain some tangible experience to add to their resume and whatnot. And so we're not saying that, but having a requirement of having to do certain things can be a barrier for folks who have challenges in completing those types of tasks. Rules and expectations focus on health and safety and not to impose unnecessary burden. And that's really the theme of what these policies are talking about. So we've seen communities who go through this shelter transformation process and really look at their policies with that specific lens. Like, is this policy necessary for supporting the health and safety of people staying here, of staff, of the organization? And if not, is there a way to adjust it to reduce the barrier or remove it altogether? Pets, possessions, and visitors are allowable. We've talked quite a bit about pets and the importance of that. So it's great to hear that there's spaces where pets are allowed in your system. Possessions came up. And we're going to talk more about that in our environmental framework, but that is a big one. And it's really tough to navigate because we know that there are risks with having people bring their possessions inside, but also it's, there's space that's needed for that and all that. So we're going to talk more about that. The visitors piece is interesting. So shelters aren't historically spaces where visitors might come, but it can be a way to really support people in maintaining their natural support systems, which we know is incredibly important to helping people in their housing stability. We see a lot of folks lose those connections with folks while they're staying in shelter. So having policies that actually allow for visitors and space that allow for visitors can be really helpful. Finding dignifying ways to address rule violations. So thinking about how your shelter handles conflict resolution, not having a one-strike rule, thinking through what are some restorative practices, if you all have used restorative justice frameworks in your practice, and then opportunities to adjust behavior. So we're going to talk a little bit about that a bit later as well. But really, it's this idea that discharges from shelter is a last resort and you're trying to find alternatives like breaks or triaging to other shelter in instances where that is needed, but not wanting to discharge folks. And then very importantly, which we'll talk more about, is clear protocols and addressing substance use and behavior challenges as well. Any questions or thoughts about these? Okay.
All right. So environment. Oh, actually, I see a hand. Go ahead, Dion.
Oh, hi there. So I just want what you're saying in regards to rules and such for sheltered persons reminds me of a time when I was in a shelter in South Carolina, and they had a rule that you do not open the door ever to anyone. If someone rings the bell or knocks on the door, you have to go to one of the administrators. And we were all like, yes, absolutely. But then it just so happened I was walking by the door and I was in the shelter and someone knocked on the door or rang the bell. I think someone rang the bell and I opened the door just out of instinct, just out of natural instinct. Just, someone knocks on the door, you open the door. And then they asked for someone and I said, oh, of course, no problem. Just one moment. And I closed the door. And when I went to the administrators, they got really upset. You never open the door, because of safety issues. So that was just something I just was thinking about. I wanted to share. That's all. Thank you.
Yeah, thank you for sharing that. And, I hope this was not your experience, but I could imagine in some instances, right, in a more punitive shelter setting, like that could get somebody in, quote unquote trouble.
Yes, I was in big trouble. Yes.
Yeah.
Yeah.
Any other thoughts or comments related to the policies? Okay. So we're going to talk a little bit about some of the environmental conditions that can help to reduce barriers for folks. And you all have actually touched on or described several of these already that you're currently operating, which is very cool. This first one especially related to space configuration for people who need something different than what we think of in that traditional shelter model of a big room with lots of people sleeping in it, right? So whether that's for different family structures or couples, super cool that you have shelters designed for couples in Rhode Island. I know we often hear in communities that folks who have older children also have difficulty in shelter systems because many of the family shelters are designed for families with children who are, under the age of 14. And we see conflict come up a lot when folks maybe have children who are nearing adult age, 17, 18 years old. Folks who are gender diverse and may need, different spaces than a big, again, communal room. And this might be something that, has to be addressed at the system level, can't necessarily be addressed by an individual organization for a variety of reasons, whether that's resource capacity, literal actual space, that sort of thing. But it's a great way to reduce barriers for populations for whom the traditional models just don't work. Another way to lower barriers from an environmental perspective is to really, wherever possible, foster privacy and access to belongings. So Jenna touched on this, but some of the ways that we've seen shelters across the country try to do this is through things like having maybe storage programs for people to be able to keep their belongings safe during the time that they're experiencing homelessness, whether that's like, financial assistance to cover the cost of that storage, whether it's more access to a, bigger storage space than a small drawer, someone mentioned, in the actual shelter itself. Something called amnesty boxes is another approach that some shelters have taken where maybe folks have materials on them that they are not allowed to bring into the shelter, but there is a locked and safe space where they can leave them for the time that they're going to come in and sleep, and then they can have access to them when they leave. Using metal detectors instead of searching people's bags. So, right, really, what are we looking for in a search? We're looking to make sure that people are going to be safe and not bring a weapon into the shelter. A metal detector can accomplish that without having to go through somebody's belongings, which can feel really demeaning, right? If anybody's, been at the airport and had their bag chosen off of the belt, it does not feel great to have somebody dig through all of your stuff. And then another way could be creating some kind of separation between beds. Even in that more traditional model, I think there are ways that can be explored to create, bed separators or more spacing to kind of deconcentrate those areas where people do still have to sleep in a group setting, but to just allow them to have a little bit more privacy and therefore a little bit more dignity. I see Amy in the chat mention that there's lockers at Hartford Ave, which is amazing. And I think even, the size of storage spaces is really important. Like I'm recalling once being in a shelter and witnessing this argument between a guest and someone at the front desk because they wanted to bring in their laundry detergent. And that's like a bigger item, but it's really expensive, right? Laundry detergent is one of those things that every time I'm like, oh my gosh, almost $20 for this laundry detergent. And she was so devastated that she couldn't bring that in because when you have a fixed income, when you for all these reasons, right? She really wanted to be able to hold on to that laundry detergent. And they had some arbitrary rule in place around the size of items that were allowed to go into the locker. And so she wasn't able to bring it and had to go hide it outside. And it just created this conflict that didn't feel totally necessary and was based on this environmental rule that probably could have been explored. to find a way for her to be able to keep that laundry detergent safe. Making sure that folks in the shelter have access to naloxone, to sharps containers throughout the building that are clearly marked, easily accessible, to be able to address concerns around substance use and potential overdose. Another way to address this is with motion detectors in places that are more private, like a bathroom, where we might worry that somebody's been in there for a long time and we're not sure what's going on. A way to flag, if there's a lack of motion for a period of time. One of you mentioned that you've got shelter space that allows for pets, which is really incredible. That is something that we hear across the board as a reason that folks are not coming inside, that it's largely many times because they can't bring their animals with them. So having either a policy that allows for that or a partnership with an organization that can keep pets safe, like a shelter or rescue type of situation, while folks are staying in shelter. Having physical infrastructure that supports housing search and people's ability to maintain connections to their natural support systems. So outlets, I recall a time when I was working with a shelter that didn't allow people to use their cell phones. And I think from their perspective, this rule was in place because they were worried about people stealing each other's cell phones. And when you think about it now, and this was many years ago, but thinking about it now, it's like, holy cow, how were they expected to be doing any kind of housing search work or, maintaining service connectivity, staying on top of appointments, contacting landlords if they couldn't use their cell phone, from 4 p.m. to 7 a.m. So making sure people have places to charge them, to be able to use, computers, access to Wi-Fi, et cetera, to be able to do all of those things that we want them to be doing, right, to move on from shelter. Offering people quiet decompression spaces. So someone shared a great example of that too, right? People need space and time to be able to decompress. I love the example of the couple shelter where they even considered that for people who wanted to be staying together, but maybe still needed some space occasionally to be able to cool off, like any of us might, right? So being intentional about creating spaces where people have the ability to do that. And then lastly, just really trying to ensure that the shelter environment is uplifting. A lot of times, what things look like is not necessarily what we're thinking about, but it can make a huge difference when you talk to people. The color of the walls is something that, you might not think about, but can make a huge difference in the way that the space feels. So really trying to encourage an uplifting spatial environment that's non-judgmental, that allows for people to feel dignified.
Okay, so now we're going to talk about services. This is the last kind of bucket in the framework that we're going to talk through. So first and foremost, having diversion and housing problem solving as part of your shelter entry process, or even before people kind of figure out which shelter that they might stay at. If you have a very coordinated system around that, that might be through like a hotline, that might happen there. It might happen again when they get to shelter, whatever that looks like, but having that opportunity for people to get support in thinking through what are my options, and maybe emergency shelter isn't my only option here that I could pursue. So having that as part of your system or specific shelter is really important. One, because it reduces inflow, it helps people avoid the experience of having to stay in shelter and the difficulties of getting out of shelter and into permanent housing. So for many reasons, it's really important to have that as a service. Housing focused case management and other resources to foster housing connections. So coordinated entry assessors and housing navigation, legal assistance, helping folks obtain vital documents, transportation access, income maximization, all of the services that you typically hear about in shelters that are very housing focused have also shown to to support this low barrier shelter model as well, because it is helping people kind of move on to permanent housing and not have to stay in that type of environment long term. And because it aligns with the Housing First model, which acknowledges that maintaining these service connections, supporting your own goals around health, well-being, employment, increasing your income is all very difficult without a permanent, stable place to stay. Having health-related supports on site has proven to be really important, especially in shelters that are low barrier and specifically tend to serve people who are actively using substances. So that could look like strong connections with mobile healthcare units, having clinics embedded into the shelter, or having specific days where those services are on site, or any primary care services on site. Behavioral health to support medication management and treatment is really helpful too. So if that's not on site, having really strong partnerships that make that really accessible for folks. And I would say having some health related supports on site, whether that is clinicians who can support behavior modification planning with folks, whatever the most common need is, having that on site can really make a huge difference. And then interdisciplinary teams. And so not only having someone work closely with a housing navigator, whoever it may be that's supporting the housing search, but also helping them manage their mental health or substance use, whatever seems to be a large barrier to them being able to stay in the shelter. Any questions about these, or any of you who have other services that have been really helpful in making a low barrier model possible for you all? The other one I'll say that we haven't framed as a service before, but I can imagine or have even seen it be really helpful, is just having folks who are really skilled in conflict resolution. And we'll talk a little bit about training and how important de-escalation practices are, but conflict resolution can be so incredibly helpful in environments that have a lot of different people who are living in proximity with each other. So not only those decompression rooms, but also support in navigating those challenging situations as well. Okay. So we are going to take some time in breakout rooms. And I just realized that I don't have a Google Doc for these questions. Okay, you're gonna.
I just did it, Jenna. Yep.
Oh, thank you. Okay, so we're gonna do some time in breakout rooms again. I think we'll do about 15 minutes or so. Maybe we'll check in halfway through and see where y'all are at. But we're gonna have breakout rooms, one for policies, one for environment, and one for services. And we're gonna have you choose whichever room you want to be in. And what you're going to do is just talk through with each other, like if there are characteristics related to a policy, environmental aspect, or a service that currently act as a barrier in your system or in a specific shelter that you work in, what you would do to change or reduce that barrier. And then what would you need in order to make it happen? Do you need funding? Do you need a specific partnership? Do you need leadership to really spearhead something? Do you need buy-in from certain people in your community? Like, what would it take for you to be able to reduce that barrier? And it might be really simple. It might just be like, we just need to work to examine our policies and test something out. So like I said, we're going to give you about 10, 15 minutes. We'll maybe check in halfway through and see where you're at. But really dig in and think about what policies, environment, and services you currently offer that could be producing barriers for folks. And this is a non-judgment-free zone, I'll say. Like, we've mentioned this a few times, but a lot of these policies are well-intentioned that you might have in place. A lot of these things may have happened over time. But it's always a good idea to step back and kind of examine how you're doing things, and give yourself grace for the decisions that your shelter made along the way. But this is an opportunity to shift things and really make it easily accessible for folks. So Ellen put the, oh yes, so activity 2 is on that Google Doc. So take a moment to open the Google Doc before we open the breakout rooms, so to make sure you have access to it. And then, like I said, you're really just focusing on picking a policy, environment, service, thinking about how you could reduce it and what it would take, what resources you would need in order to reduce or eliminate that barrier. Okay, I think we're all back. Hopefully you had a chance to figure out who from your group was going to volunteer to speak. But we're just going to go to each of the rooms and see, if you can share some highlights from your conversation. So we'll start with room 1, which was focused on policies. So someone from room 1 just want to tell us about the conversation.
Yeah, I can do it. We were talking about the gray areas when it comes to the curfew and when people can have smoke breaks. How one person can say no and then someone else will say yes, and that'll cause friction across different shifts. And we were trying to think of a way to solve that. One idea was like a checkout system in a way where clients are able to like sign their name and time they go out, and then they check back in when they come back in. Of course, that would be like regimented in a way they can't leave for like 4 hours or something like that. They would only leave for like a smoke break, that the reason why we made the checkout system, we'd have to find a way so that they wouldn't take advantage of it, but I doubt anyone really would.
Yeah.
Another big thing was the amount of items allowed in the shelter and how to, I feel like we were all just kind of venting about the stress of it because we don't like getting rid of client items. We wish we had more space and resources or services in order to kind of safeguard people's things. You know what I mean?
Yep, definitely. Yeah, the possessions thing is really difficult because it really does come down to space a lot of the time. So that is a really tricky one, but something you said made me think of, we might talk about this a little bit next, but just the burden that some policies actually put on staff as well, and how difficult it is to uphold certain policies, especially when you as a staff person really don't want to or really not bought into the policy. So it just made me think of that too. And we haven't talked too much about that yet, but we kind of hear both sides of it of sometimes it really creates difficulties for staff as well to have to uphold a policy.
Especially if say someone relapsed or something one day and they weren't able to come back and that was their last straw. And it was a simple, they didn't mean to do that. It just kind of happened. A lot of stress built up, and then we have to get rid of their stuff because they aren't able to get it back in time. That's not easy.
Yeah, that's really hard. Right, really helpful. Anyone else from group 1 want to share something? Okay, cool. Sounds like there was some good troubleshooting to overcome some of the barriers. Group 2, which I think was focused on it in the environment. I think that was a pretty small group, but anyone willing to share a little bit about the conversation?
Dion didn't have very much time to share within our group, so I didn't know if she wanted to speak.
No, I just was, okay, I'll be very brief. Yeah, we were talking about the part that I was contributing was when I have lived experience in one of the shelters here in Rhode Island. I think I've been in every place I've ever lived, I've ended up in a shelter. So before, of course, I mentioned South Carolina. In Rhode Island, I was at a shelter for a period of time with my daughter, and the walls were very gray. There was a lot of cement. It was very cold. And I remember thinking what you're talking about today is that, the environment was not warm. It wasn't even kid friendly either. So I mean, it had children there, but anyway. So
that's a really good point. Yeah, being kid friendly too. I didn't think about that one. Yeah, so just kind of the feeling of the coldness and the environment wasn't warm, that can really make an impact on someone on the day-to-day. Anyone else from group 2? Okay. So group 3, I think, was a pretty big group. Services. Anyone from group 3 volunteer to share out?
It was pretty chatty in that group, so if folks are feeling quiet, I can give an overview. The folks who spoke were primarily folks who do referrals and provide connections to services or provide services, not so much folks in physical shelters. So we sort of talked about a little bit about what we did for Kenny and I's part as folks who are at a shelter often for House of Codec. I think we joined the services group primarily because we feel like our environment is unique among shelters and is sort of the residents have a lot of kind of control over it and the ability to kind of put their mark on the space, even in the common areas. So we didn't feel like that was as much of an issue. But services wide, you know, I think Kenny and I have talked outside of this training too about like just kind of providing more structure, not in order to like enforce one linear way of doing something like housing search or job search, but just as a starting off point, because people can feel pretty scattered when they're trying to kind of collect themselves in an emergency shelter environment. So sometimes structure can at least be a jumping off point.
Totally. Yeah. Great. Anyone else from the services group? Okay. And I'm curious to hear, did anyone, not just specific to group 3, but in any of the groups, did any of you make it to a conversation about like, what would you need in order to reduce, you know, whatever barrier you were talking about?
More funding.
More funding? Yeah, what
Yeah.
else? That's always the answer, right?
I would
Yeah, in
say,
our group, go ahead.
I would say relationship building amongst other organizations. I was in group 3, and sometimes, you know, it's good to have that relation amongst other organizations to have that close in that referral, because sometimes sending referrals out there, sometimes it isn't like they mentioned funding or the programs have closed.
Yeah, that's a really important point. Thanks for saying that, Wendy. And I think someone else had come off mute.
Yeah, I was going to say in our group, we talked about the importance of talking about gray areas and having a culture where staff feel comfortable making exceptions to policies, because no matter how well-intentioned a policy, humans are so much more complex than rules, and there's always going to be cases where there's gray areas. And I think like leaning into that instead of trying to stick to this unattainable black and white ideal is something we talked about.
Yeah, I really love that concept. Yeah, finding that, Ellen has heard me say this so many times, because when we talk about the housing programs or whatnot, it's also thinking about the balance between structure and flexibility. Like, and Ben, this kind of goes to what you were saying, like people sometimes do need some structure and some predictability and know what to expect, but there's always going to be situations that have nuance with them because humans are complex and need some flexibility and operate differently from each other. So I really like that. Okay, fantastic. So we have a few more slides. We're just going to touch on how do you go about making this shift, and really driving home that the process is just as important as the change that you're going to make. So how you go about making the changes. This is just very high level what we see as like a typical process that can be really helpful because it includes a lot of different players in the system that have a vested interest in low barrier shelter. and how to, this process actually could be a circle, and we're going to talk more about how do you evaluate and adapt along the way. So first and foremost, it's always a good idea to start with what does our system or our specific shelter specifically look like. And if you were at our training last month, you know that we really support this idea of making changes from a systems perspective. So using this idea that, you know, one shelter isn't going to be able to do every single one of these things and be the most low barrier situation for every single person in the system. It's really the systems approach to make sure that there's specialized spaces for people, that there are low barrier shelters, and we know that that's not going to happen uniformly. So evaluating what the system shelter needs are, and I should say that should involve a lot of different people, right? It should involve shelter programs, but also other types of programs who support people who are staying in shelter. It should involve street outreach who support people who have chosen not to stay in shelter. It should involve people who are actively staying in shelter and have that perspective. Understanding and discussing concerns with the community.
Jenna.
Oh, sure.
You are not sharing your screen.
I'm not sharing my slides. Thank you. Okay, well, you didn't miss much. This was the last slide. Thanks, Ellen. So high level, this is the overview, talking through understanding and discussing concerns within a community. So again, that involves a lot of different people who have different perspectives of the shelter system. So really digging into what are the concerns people have about doing a low barrier shelter, and taking those into account from the beginning. And when we say community, we're actually also talking about businesses in the area, the neighborhood that that low barrier shelter might be in. So really involving folks from the process early on to make sure they feel heard and that you can take into account their concerns as you're creating these changes in a shelter or starting up a new low barrier shelter. Assessing current barriers to shelter to shift to the low barrier model. So you all just did that to some extent in these two activities that we did today. So in the first activity, you really talked about where are we at with these principles that really support low barrier shelter. And the reason it can be helpful to really focus on principles is because oftentimes we don't have the foundation of principles to guide our decision making. We make decisions about policies or the environment or services as a reaction to the current state of homelessness in a community or to an event that happened, which isn't wrong. But we also want to balance that with guiding principles. So really understanding how principles can help drive decisions to be made as well. So assessing your current low barrier model or lack thereof to see where changes could potentially be made, and then collaboratively planning for those changes. And then when you get to implementation, it's really important to think about implementation in phases. So in some shelters, they're like, wow, we have a lot of changes. You know, when they get to this assessing current barriers, they might say, we have a lot of changes that we need to make in order to shift to a low barrier model. Or maybe your community found that we have a lot of different types of shelter, but we need one to really adjust to this low barrier model because we don't have that in the community. When there's a lot of change that would need to be made to align with a low barrier shelter model, doing it in phases can be really helpful. And then evaluating those changes as you go and adapting as you go. Some common challenges that we often see are community buy-in, and ways to address that might be, like we said, involve the community from the beginning, really educating folks on how they could be positively impacted by low barrier shelter and be honest about how you're addressing the challenges. So we don't want to ignore the challenges or discount them because they're real, but we want to find ways to address them and also help the community at large understand the importance of the low barrier model. And then also providing a space, a very easy space for feedback. And I should have put in here, not only hearing the feedback, but incorporating it when possible. Lack of support for staff. So we've seen very different reactions from staff who are in shelters. So that could be shelter operations, it could be service providers in shelter. In a lot of ways, lowering barriers can reduce the burden on staff to uphold those barriers. So that can be really helpful and lighten the load and burden for shelter staff. And on the other hand, there's different challenges that come with low barrier shelters at times, especially ones that are more oriented for people who are struggling with their mental health or actively using substances. So it's incredibly important to involve staff from the beginning of the process, both in planning and implementing and evaluating how things are going, really allowing a good amount of time for supervision and consultation so that they can talk through difficult situations, getting training as they go instead of, having one training a year, but really supporting people and incorporating practices like harm reduction and trauma-informed care. Identifying and addressing signs of burnout is incredibly important. And then training specifically on conflict resolution and de-escalation techniques can be incredibly helpful in people managing tricky situations. And then behavioral challenges can come up. So having clear protocols on how to handle substance use or the selling of substances on site. And I want to be clear, like by saying low barrier shelter, that does not mean that you're allowing active substance use or selling of substances on site. We're not saying like, you become a site like that. It just means that you are, creating situations where people who might be actively using substances to come inside. So amnesty lockers that Ellen mentioned earlier is a good way to help people in a harm reduction way. They have a place to put their materials for substance use or weapons or whatever it may be into an amnesty locker and not bring them inside. But when those situations do come up, having clear protocols on how to handle them. Monitoring folks who are intoxicated, overdose prevention and response is incredibly important. And mentioned this earlier, but on-site behavioral health supports and clinicians who can support behavior modification plans for people who are having a really hard time abiding by the rules that you do have in place for people's health and safety is a good way instead of just, automatically discharging people or even doing like a 2-strike or 3-strike situation, but actually working with people to shift their behavior instead of just using a penal system. And then I think it goes without saying, like, the other challenges are things like space and funding and whatnot. And I'll just say that's why just another reason to use this systems approach. We've seen communities like pool their resources. And Wendy, you mentioned like strengthening partnerships with external service providers and just kind of like talking with each other and having closer connections. Pooling resources can be a very helpful way to overcome funding challenges in a community. And so instead of every organization competing for the same funding to do the same thing, like pulling resources to make sure you have a system, it's also a lot more person-centered to do it that way as well, because it's really focusing on like how can our system serve the person instead of each of our organizations do that. Okay. This is just a continuous equality improvement model that you may have heard of. It's called the Plan, Do, Study, Act model. And it's just this idea that you don't just make a change and then let it go, especially in a situation where you're implementing in phases. You might pilot certain policies or changes to the environment or services and evaluate how they go. And then you may have heard of this framework, but you might choose to adopt, adapt, or abandon that change. So adopting, you would move forward. Adapting, you might need to tweak to make it better. And then abandon might be like, it didn't work. Let's just abandon that idea and try something new. Okay, so we're about ready to wrap up. I will, we only need about a minute or so though. So if anyone does have a question, I don't think we have anything in the Q&A. And do we have anything in the chat, Ellen? Okay. We will be sending out the slides, and we do have a feedback form, which is incredibly helpful for Ellen and I, but also for Rhode Island Housing if you fill it out. It's like four or five questions, super easy, but really helpful for us as we're shaping future trainings and for Rhode Island Housing as they continue this training series throughout the year. And if you attended and signed into the training via chat at the beginning of the session, you will receive a certificate of completion as well, as long as Rosa has your contact information from the registration. So just wanted to say thank you for your time. The slides will also be going out, and we've included a slide that has some resources on it so you can dig deeper. One thing I'll flag is this low barrier self-assessment and action plan. If you are like bought into this idea of low barrier shelter, this is a good next step, is to do this self-assessment that's a bit more specific about policies in your shelter and action planning. So hopefully you left today with some specific practices you can take back to your shelters and your system and really talk through. Rosa, anything else you wanted to add before we let folks go?
Yep, I like Jenna mentioned, I will be sending out an email shortly with the slides and the survey requesting your feedback. Thank you.
Okay, great. Well, thank you so much, everyone, for being here. I think we're good to wrap up if anyone doesn't have any questions. Okay, good to see you all. Have a great rest of your day.
Thank you.
Thank you.